Today's topic is endometriosis. Let me outline the contents of this presentation. 1. Introduction to endometriosis. 2. Symptoms of endometriosis. 3. Females who are at risk of getting endometriosis. 4. How to diagnose endometriosis. Introduction to endometriosis. Firstly, let me define endometrium before I define endometriosis. Endometrium is the mucous membrane lining the uterus. Endometriosis is therefore the presence and growth of functioning endometrial tissue in places other than the uterus. Endometrium can grow on the ovaries, behind the uterus, tissues that hold the uterus in place, on the bowels, fallopian tubes, vagina, cervix, vulva, rectum, or on the bladder. Rarely, it grows in other parts of the body, such as lungs, brains, and skin. This misplaced tissue can cause pain, infertility, and very heavy periods. The pain is usually in the abdomen, lower back, or pelvic areas. Symptoms of endometriosis. Some women may have symptoms and others will have no symptoms at all. And having trouble getting pregnant may be the first sign they have endometriosis. Some symptoms of endometriosis can include 1. Pain. Very painful menstrual cramps. Pain during or after sex. Long-term pain in the lower back and pelvis. Intestinal pain. Painful bowel movement or pain when urinating during menstrual periods. 2. Bleeding or spotting between menstrual periods. 3. Infertility or not being able to get pregnant. 4. Digestive problems such as diarrhea, constipation, bloating, or nausea, especially during menstrual periods. Please, if you notice some of these symptoms, please go to the clinic for proper diagnosis and treatment. Females who are at risk of getting endometriosis. Endometriosis is more common in women in their 30s and 40s. However, endometriosis can occur in girls having menstrual periods. Females who might be more likely to get endometriosis. 1. Never had children. 2. A health problem that blocks the normal flow of menstrual blood from your body during your period. 3. Short menstrual cycles, 27 days or fewer. 4. Menstrual periods that last more than 7 days. 5. A female member, mother, aunt, sister with endometriosis. Diagnosis of endometriosis. Endometriosis is difficult to detect and it takes a long time to diagnose. When endometriosis is suspected, pelvic exam is done first. During pelvic exam, endometriosis is a possibility when nodules are felt on the ligaments behind the uterus or an enlarged ovary. Diagnosis of endometriosis cannot be based solely on a pelvic exam. This is because there are other conditions that have some symptoms similar to endometriosis. Ovarian cysts, ovarian cancer, interstitial cystitis, irritable bowel syndrome, and pelvic inflammatory disease. To avoid a misdiagnosis, appropriate follow-up exams need to be done. CA125, blood test, laparoscopy, ultrasound, CT scan, or MRI. Elevated levels of CA125 can indicate advanced endometriosis. However, elevated CA125 levels is not a definitive diagnostic marker for endometriosis. This is because elevated CA125 levels can also be caused by conditions like fibroids and ovarian cancer. Laparoscopy is finally used to confirm diagnosis and possibly treat endometriosis. Laparoscopy is the only way to confirm that a woman has endometriosis. Endometriosis should not be aggressively treated unless it has been accurately diagnosed. Thanks for your audience. Please, thanks for watching. Please subscribe to our YouTube channel, Al Hafel TV, for more health education. Thank you.